There are some really interesting sessions that I've spotted in the programme this year, and one is on bariatric surgery. And welcome to one of the speakers. So tell us who you are, first of all.
I'm Louise Baur. I'm Professor and Head of Child and Adolescent Health at the University of Sydney, and I'm a long-term paediatrician working in the management of obesity in children and adolescents. And I work at the main children's hospital in Sydney, the Children's Hospital at Westmead.
So first of all, just tell me why bariatric surgery and diabetes could work together.
Well, certainly with some people with type 2 diabetes, obesity is a major risk factor, and weight loss can dramatically improve a whole lot of diabetes-related outcomes and other health issues. And bariatric surgery can be a very effective treatment as part of the broader approach to treatment for people affected by obesity. And so it's not the first-line treatment, but it's part of a whole approach that we need to provide in people affected by obesity, including those with type 2 diabetes.
Now, bariatric surgery isn't controversial in this community, but it's very controversial for the public, for payers, and in the media it's often given a very negative press. How do you overcome that?
I think that reflects a very long-standing and deeply embedded stigma towards people affected by obesity. There is this wrongly held view that it's somehow a moral failing of gluttony and sloth, and not recognised as a significant disease that needs its own appropriate treatment. So the general community, and I might add many people in the health system, buy the lie that this is something that an individual can do on their own and can have a very negative view towards people. In fact, payers themselves should actually think and rethink about the impact of things such as bariatric surgery, because there may well be much better cost outcomes if people are treated, people who need this treatment are provided with it and have much better health outcomes than if they're allowed to continue with untreated obesity long term with all its attendant consequences. Now, I'm not saying that everybody with obesity needs bariatric surgery. It's like a pyramid of care. Everybody needs high quality support for lifestyle change, and indeed for many people, particularly with more mild to moderate obesity, that is very effective, and it can be adjunctive to other forms of support. We need drug therapy, we need more intensive dietary interventions, and I'll talk briefly about that as well. But we also need, at the top of this pyramid, the option to provide people with bariatric surgery in a safe and effective way.
Now, you're talking about the do's and don'ts. So first of all, who is the ideal candidate? And we're talking children and adolescents.
Well, we're talking about adolescents, and I think most consensus guidelines would talk about adolescents who've essentially attained skeletal maturity, so about 14 or 15 years and above, who have severe obesity, so that's a BMI of 40 and above, or those with a BMI of 35 with type 2 diabetes, severe obstructive sleep apnea, or severe fatty liver disease as examples, that those are the appropriate people. They need to be people who are recognise that they need to be involved in a program prior to operation and need to be followed up essentially long-term post-operatively. It's not a quick set and forget approach. It's something that's needs to be approached carefully. So a lot of that's to do with how the teams support the young person and their families so that they can approach surgery with the right support, rather than just expecting people to have that approach to start with. As time gone by, I think we recognise that even issues such as disordered eating or some psychosocial stress can, as long as they're supported, can actually still have good outcomes. I think the real issue is that it's often not provided for people affected by obesity and type 2 diabetes, rather than the people don't meet the criteria.
And how should people like you make the case?
I sometimes talk about the bruise that I have in my forehead, which is from banging my head against a brick wall. It's not just for bariatric surgery, it's for effective treatment of obesity overall. People affected by obesity, particularly those with moderate to severe obesity, need access to really high quality treatment, multidisciplinary teams in a range of places, and with that they also need access, if needed and appropriate, to bariatric surgery in the public healthcare system. How do we make the case? I think we've already got enormously good data showing that there can be very good outcomes, up to 5, 10 years, etc. Even for adolescents affected by obesity, we can show that there are improvements in a whole range of comorbidities. So we should probably just look at the data, but we also have to help people overcome their stigma about obesity, and I think that's been one of the big barriers.
And that's really, I suppose, dealing with the media and the perceptions and overcoming the stigma more generally in the population.
Yes, I think even a lot of people who make decisions, so bureaucrats, health service managers, actually have the community attitudes towards obesity. Most people aren't trained in thinking about or managing obesity when they're at medical school or as nursing, allied health undergraduates. They're not trained in how to think about obesity or manage people affected by obesity, so it's easy to pick up the general community attitudes towards this if you're not careful.
Finally, one tip for the person practicing, looking after diabetic patients in their hospitals around the world. What would your one tip about bariatric surgery be?
My one tip for everybody working in diabetes and who are thinking about bariatric surgery, make sure that you're involved in your patients and you are involved in a bariatric surgery registry long term, so that we can all learn about the outcomes and how best to provide treatment for these people.
Very interesting and an excellent piece of advice there. Thank you so much.
Thank you.